Hi guys, today we're going to work on starting a peripheral IV. So first we need our arm, which we have in our nice disembodied arm here, but then we need our supplies. So we have a pigtail, we have our IV catheter, we have our kit, and our kits are all basically the same. Some kits can look different, so you just have to get used to the kit that your facility uses. I've got some sterile flushes, and then I've got my gloves. All right, so we're gonna open everything up. And I like to usually talk to my patient and tell them what I'm doing. Now, what I'm gonna do here is I'm gonna prime my tubing, okay? Because we don't want air to go into our patient. So what you'll do is kind of pull it out of the packaging. You want to leave that tip in there because it's sterile and clean, and this hasn't touched anything yet, so it's still sterile. If it wasn't, you would just use an alcohol wipe to do it, and then this just screws on, so you have to use a little muscle and screw it on there and twist, and then you can see the drips coming out. So my tubing's primed. Okay, I'm going to open my kit, again talking to my patient because they might be a little anxious about this. And I'm going to look at what my kit has in it. And my kit has a tourniquet for my patient's arm. Okay. A cleaning solution, an alcohol wipe, a little cloth pad here, some tape, and then the ever so famous and wonderful Tegaderm that we use, which is that transparent dressing. Okay. So I'm going to talk to my patient, and I'm going to tie a tourniquet around their arm. And with these guys, their veins don't bulge, but when you tie that tourniquet, you can have them squeeze their hand to get those veins to pop out. Use gravity, bring the arm down, and that will help as well. Okay, and I'm going to kind of look for things, look for veins kind of starting to pop out. Looks like I've got a good one right here, so I'm going to kind of clean with alcohol. Sometimes that helps that vein pop out a little bit. And then I'm going to use the cleaning solution. We're not actually going to use betadine on our mannequins because we don't want them to be all nice and orange, but we're going to say we did. Okay, and while that dries, I go ahead and get my gloves on. All right, and then I've got my catheter tip here. All right. And this is a 20 gauge. And this, when we put them in, we want to put it so that the bevel is up. And then we're going to tell our patient, we're going to have a little poke. And you want to kind of go in and scoop that vein. All right. And in a real person, you'll get a little blood flash in here, and that'll let you know that you're in the vein. You're going to go ahead and advance your catheter, and our rubber mannequins are definitely a little bit harder to advance on. Okay, so we're going to advance it forward. I usually untie my tourniquet at this point in time. Okay, and I'm going to pull out my needle, and you can see it has the safety there. I like to make sure that I'm in the vein before I start sticking tape on them. So I've got my primed tubing here. I'm going to attach it, and I'm going to go ahead and flush it. Okay. It should flush, but it's not really going. And then once I've flushed about 5 mL, I'm going to go ahead and stick my Tegaderm on. Get it all secured, tape this down, and have this all ready, and then we'll date and time it like we would do any other dressing.